Good afternoon, everyone. Thank you all for coming. Got to hold it closer. Good afternoon, everyone. Thank you all for coming. Can I ask one more time that everyone silence his or her phone? A little button on the side, make it go orange or whatever you do for the other ones. Dr. Rezai, President Yi, distinguished visitors, guests, and the esteemed residents of Edgemere. I'm honored to get to introduce our special guest today, but I want to first recognize one of our residents, Jean Young, who's sitting up front. Jean is the one responsible for this visit. She has been extremely generous in her support of Dr. Rezai's Neuroscience Institute. And because of her generosity, I am now privileged to shortly introduce the executive director, Dr. Ali Rezai, who also occupies the John D. Rockefeller IV chair in neuroscience. Dr. Rezai is a pioneering neurosurgeon who has devoted his career to advancing the treatment of neurological and mental health conditions. In his leadership role at West Virginia's Rockefeller Neuroscience Institute, he has created a world-class patient care and research institute handling more than 300,000 annual patient visits for neurological and mental health conditions from all 50 states and 17 countries. 300,000 a year. Dr. Rezai has led multiple teams in research innovations resulting in breakthrough treatments in Parkinson's and Alzheimer's diseases, brain spinal cord injury, and addiction. His work is especially interesting to me because I lost my younger brother to Parkinson's last year, and two of my close friends here at Edgemere are suffering from this terrible disease. Dr. Rezai has authored more than 250 scientific publications, holds 65 US patents, and has received numerous awards, including the Cleveland Clinic and Ohio State University Innovator of the Year Award, the North American Neuromodulation Society Lifetime Achievement Award, the National Institute of Health HEAL Award for Excellence in Research, and the Ellis Island Medal of Honor. Dr. Rezai is a frequent speaker at medical, scientific, and tech conferences and has presented his research to the President of the United States, members of Congress, governors, Secretary of Health and Human Services, and National Institute of Health directors. His research has been featured in the Wall Street Journal, as some of us already know, the New York Times, the Washington Post, on 60 Minutes, as many of you have seen this week, the BBC, and all the major US television networks, including appearances on Good Morning America and the Today Show. As I said at the onset, it is indeed an honor to be able to welcome such a distinguished American. Will you please join me in welcoming Dr. Ali Rezai and the RNI team to Edgemere?
Good afternoon. Can you hear me? Thank you very much, and we appreciate the opportunity to be here among the distinguished audience, and I'd love to thank Mrs. Jeannie Young very much for the tremendous support that you've enabled our innovations for Alzheimer's, so thank you very much for what you've done for us. Admiral Beard, Mrs. Beard, thank you very much. And also I want to thank Holly Worrell, Director of Lifestyles. Where's Holly back there? And her great team, Layla and Jaime, and Teresa Bates, and all of you for your kindness to be here and giving us the opportunity to speak about the work we're doing to helping people impacted by neurological and mental health conditions. Can you hear me okay in the back? Is okay? Good. I also like to introduce our distinguished president, President Gordon Gee. Can you stand up, President Gee, please? This is our president, President Gee of West Virginia University. So President Gee started 45 years ago as the first presidency at WVU, West Virginia University. Then he went to Colorado, president there. Then he went to Ohio State, then Brown University, then Vanderbilt University, then Ohio State, and then he capped it off by coming back to West Virginia University. And President Gee has signed 340,000 diplomas and counting. So he's an extremely distinguished, one of the most iconic presidents in the U.S., recognized by Time magazine. So thank you, President Gee. He'll make some comments. And also our team. So without the team, we cannot make progress. So I'd like to thank our team who's here, Mrs. Leslie Crossley. Leslie is our concierge lead. She runs everything. She manages 700 families across the country who are impacted by Parkinson's, Alzheimer's, and many other conditions. Mr. Wayne Richards is the West Virginia Foundation chairman of the board. So thank you. And you live in Houston, Texas. Dr. Mark Hout, who's been with us for many years, and he's a pioneer who's developed new innovations for the treatments of memory health and neurodegenerative disorders, Dr. Hout. And Dr. Ann Murray, who runs our Parkinson's and movement disorder program. And in my 26 years, I've been at New York University, Cleveland Clinic, Ohio State University, and West Virginia University practicing. She's the best neurologist I've worked with in Parkinson's. So there's Dr. Murray. And we'll have an opportunity to work and answer questions for all of you. So we want to give you a background about the Institute, why we formed the Institute. Let me just play a video here for 4 minutes, if I may, and then we'll go. Can you see the screen? There we go. Let me just play a video about the Institute, if I may. The Rockefeller Neuroscience deeply believe collaborate. Our experts are working hard to innovate with first trials, be able to explore technologies, advance innovation, rapid and important fashion. So that this opportunity to advance area and quickly deploy that.
Scientists, engineers, and practitioners make some medical history in a clinical trial, taking big barriers in the fight against Alzheimer's, the blood-brain barrier.
All ultrasound waves converge over the blood-brain barrier. So now therapeutics can get inside the brain.
But all of Rezai allowed us to witness this revolutionary attempt to use ultrasound to slow down and find three patients diagnosed with Alzheimer's disease. It's never been done before. Result, beta amyloid plaque targeted with ultrasound will reduce 50% more in areas treated by infusion alone.
Antibody blending faster, clean up plaque.
What was your reaction when you saw this?
Like Roger.
Now, Rezai don't focus ultrasound, clear beta amyloid faster, is FDA approval to use ultrasound to try and restore brain function to Alzheimer's.
Addiction is really impacting so many people, and we need to find solutions.
2019, the National Institute of Drug Abuse agreed to support Dr. Rezai's attempt to fight addiction with the brain. The surgery was a success. The skull is always risky. Rezai thought he could reach more patients quickly. He used ultrasound.
Non-invasive, it can be done very quickly, very precise, and has tremendous applications.
Results so far have been like
We're fighting to lose a battle, and now this opportunity and the technology that they have here is just remarkable. It's amazing.
Alzheimer's do not have a concussion program. They don't have anybody to turn to who says, hey, I think I need to take you out for a while and then go back when it's safe. It's never safe for them.
Appointment here was unbelievable. The treatment here. no exaggeration, she spent 2 hours with me, digging into my history, digging into what I'm going through, what I want to do with my life, what I expect to do with my life, and how we're going to treat. The highest.
Advancing medicine with calculated risks and pushing the frontier. So we need to push forward and take this because people with addiction and Alzheimer's is not going away. It's here. So why wait 10, 20 years? Do it now. So that's just a quick background. And I think the key things that people ask, why did we form the Institute? And I was at the Aspen Institute this past Monday on a panel with directors of NIH and other institutes. And they said, why did you go to West Virginia? So my answer is, it's a place where there's a great need because we have a lot of patients who are aging population, Parkinson's, Alzheimer's. From the heart of Appalachia, we're impacted by addictions, and it's a place of passion and purpose with a team that really wants to make a difference. In the past 7.5 years since we formed the Institute, we've had 200 scientists come to West Virginia and move from all over the world because they want to make an impact for people affected by neurological conditions. So you have 3 billion people worldwide and more than 150 million Americans who are impacted by neurological and mental health conditions. And the numbers are increasing as the population is aging. We're talking about Alzheimer's, frontotemporal dementia, Lewy body disease, multiple sclerosis, brain injury, stroke, spinal cord injury, epilepsy, addictions, people with obsessive compulsive disorder, schizophrenia, brain tumors, many, many conditions impacting so many people and their families. So there's a big need in this country and worldwide to advance neurosciences in the same way we've been able to manage heart disease better than ever before. And now we can dare to say that we have cured some cancers and you can be a cancer survivor. Our hope is to push the frontiers forward also so somebody with an Alzheimer's can say, I'm an Alzheimer's survivor. So that's an important mission for us that we helped us develop the Institute. So we formed it in 2018 as a startup. Did not exist before. And basically we established it at West Virginia University to become a leader in neurosciences in the same way that Memorial Sloan Kettering or MD Anderson are typically leaders for cancer care. The same thing, there's no leader in the world for neuroscience care. So we wanted to put a team together to develop a comprehensive patient care research, education, and founded on patient care. Like you saw in the video, we spent 2-3 hours with each patient. Every patient is important to us. We got to listen to the patient. These days, physicians have trouble listening. They sit behind a computer and looking at the computer. So you got to listen to the patient, spend time. And medicine at times is broken because it's become too big, too disconnected, and people have difficulty navigating a system. So one of our goals is to have navigators that allow each person and their families to navigate the complex medicine in terms of imaging and blood tests and clinical function and all that, and have a personalized, customized plan for each patient. That is the core mission of the Institute. Starts with patient care, and then everything else falls in place. And our goal was to accelerate public-private industry collaboration to advance patient care, health and wellness, and tackle big public health challenges, Alzheimer's, addictions, Parkinson's. So that is our mission, to push that forward. And we're very impatient to do this. So we've gone from just a few thousand patients to now managing 300,000 patient visits over the past 8 years. And we have patients from all 50 states and 17 countries come to Morgantown, West Virginia, small town, about 80,000 people as a college town, to have themselves or their families be with them to take care and understand, what's their diagnosis? What can we do? Often we may not have the answers, but then we want to provide some comfort and understanding that you'll be empowered to know what's in store, and the team is working to do the best they can to lift the burden of difficulty that you have to deal with neurological conditions. Our team is now 2,200 people. It's grown tenfold in the past 7 years. And so a lot of activity. We have 300 full-time faculty, scientists, and physicians dealing with neurological conditions and mental health conditions. So we're also expanding. So this is a map of West Virginia. It's an Appalachia, rural state. So we take care of individuals across Ohio, southwestern Pennsylvania, the state of West Virginia, Maryland, and Kentucky. And this is where Morgantown, the institute is headquartered at. At the southern part of the state is a 5-hour drive. Many patients don't have gas money to come up to Morgantown. So we've established systems where our systems and processes is taken care of at the smallest rural communities. The small 25-bed hospital has the access to the best care in the world. Whether you have Alzheimer's or Parkinson's or stroke, the same team is taking care of them with telemedicine, our team that we deploy across the state. This is our main headquarters in Morgantown, and this medical center has 38,000 people that work there, and we take care of a lot of patients. We have 250 clinical trials, and it's a very large complex that's tackling many of the world's biggest public health issues. We're very much focused about patient-centric programs. Medicine is very disjointed, so our goal is to coordinate the care and the communication with the patient and families, answer the questions, answer again. A lot of times you go see your physician, you're told you have a diagnosis that can be very disheartening for you to hear. You cannot make sense of things. They're providing a lot of information. Our goal is to provide step-by-step and answer the questions and provide a care pathway for each person. This is our multidisciplinary program, and we see 6,000 patients each year for Alzheimer's. That's Dr. Hout is going to talk about that program in a second. Dr. Murray's team, we see 9,000 patients impacted by Parkinson's and movement disorders each year. Dr. Cardenas, you saw on TV with domestic violence. He came from Barrow Neurological Institute, moved from Phoenix to Morgantown. His team sees 2,500 patients, and he's the head of the NFL's brain injury and concussion program. And we offer the latest technologies. We'll talk about those in research called neuromodulation. Ultrasound, we'll talk about that, and other technologies that's aimed to improve symptoms of Alzheimer's, addiction, and other problems. We'll talk about that. And we have an advanced recovery center. When you have a neurological injury, you have a physical problem. You also may have a problem with walking, posture, balance, visual problems, sensory. All these are linked together, and also the behavioral and emotional aspects, because you have to tackle all of these for somebody as a whole human being to help them recover from their injury and deficits. And so let's move on to these programs. Dr. Hout, I'm going to have you come up here and talk about the memory health program and how do we take patients through the memory health program. So Dr. Hout, please.
Hello? Yep. Oh. All right. Thank you for having it. My pleasure to be here. And so I'm going to talk a little bit about our memory health program. In January of 2020, director of the memory program has memory. Welcome to the club. So in January of 2020, Dr. Rezai came to me and said, we're doing this amazing research with focused ultrasound, and we don't have a clinic for these patients. Would you please help us build a clinic? He may not remember it this way. I remember it this way. I said to him, can I do whatever I want? And he looked at me like this, and I guess he decided to trust me. And so I wanted to design a program that would really take great care of patients. The reason that was important to me is because my mother was diagnosed with Alzheimer's disease and passed with it. My grandmother also had it. It runs in just about every family. And so the golden rule we came up with for the clinic is treat every patient like you would want your mother treated. All right. My mother got great care and some not so good care. And so the idea is whenever we have a question about what to do, we step back and say, what would I want to be done for my mother or another family member to help us guide us? we are fortunate that we can spend as much time as we need with every patient. So it's not like most doctor visits where it's 15 minutes, clock on, clock out, you're out. We take whatever time. Hello? Okay, here we go. Now that's much better. So we take as much time as we need. Every individual patient who is seen, they start out with them and a family member with 2 attending physicians. So, or 2 attendings rather, a neuropsychologist and a neurologist. They spend an hour with the patient and the family, get the history, do physical and neurological exams. Then we take them just down the hall and we test their memory for only 45 minutes. That's all we need. And then we go down to the bottom part of the building in the basement and get an MRI scan. So we can do it all in one shot, get that basic information. That's easy for them. It works well for us. And we can then take them the next week to our conference. Every patient we see is discussed in our conference in depth so that we know exactly what's going on and what we need to do as a next step. The most important thing that I think has allowed our clinic to really grow, though, is as opposed to some other institutions, the people who are seeing the patients, me, for example, we're also doing the research, and we're involved heavily in doing the research. The research drives our clinic. Our clinical knowledge drives our research because it's all about getting it to people and implementing it as quickly as you can. So when we've done focus ultrasound work to open the blood-brain barrier, by the way, the first time we did that was the most amazing day of my entire academic career. Thank you. When we do that work and we use monoclonal antibodies, we've got to know those medicines really well. So we're one of the leaders in the nation now in prescribing and using those medicines to help people. And so that informs our research, and then our research turns back and informs that. The same people who are doing the research are taking care of every individual patient as if they were a family.
I think, okay, good. We'll continue. So we'll just skip. This is a team here. So, Dr. House, I'm going to turn on my, actually, I'll keep it this one here. So, this is the team that we have, and Dr. House talking about is neurologists. Every patient sees neurologists, geriatrician specialists, neuropsychologists, so they can look at the attention, concentration, different parts of your brain. We do hours of testing, and these are baseline exam. Imaging specialists, PET scan that looks at beta amyloid in your brain, and MRIs that we look at with artificial intelligence to see if you have more shrinkage in different parts of the brain. That can be predictive of different diagnoses like frontotemporal degeneration, Alzheimer's, Lewy body disease, and others. Then we have geriatric psychiatry. We have pastors, spiritual guidance, very important. Dr. Howe is going to talk about the Care Partner Support Network, which is very important because anytime somebody has a disease or diagnosis like Alzheimer's or Parkinson's, it impacts the patient, but also impacts the caretaker, the loved one, the family members. And often the family member has to take care of the patient on one shoulder and then take care of everything else. So the burden is very large for the caretaker, and often the caretakers are very depressed and they have they can get chronic disease. So we have to take care of caretakers. So we'll talk about that program for caretaker as well. Administration that supports it. We do several thousand infusions for Alzheimer's. We're probably one of the top 3 centers in the world with Alzheimer's antibody infusions. And we have the navigators. They connect the dots for the patients, take them from one place to the other to make sure there's a smooth experience. And then this is our infusion suite. And you can see the monoclonal antibodies, we'll talk about that are used for Alzheimer's. We're the top 3 prescribers in the world. And also we establishing clinics, not only in Morgantown, but all across the state and in Eastern Ohio, Southwestern Pennsylvania, all over. So the same team is able to take care of individuals. So you don't have to drive 5 hours to get to our clinic. You can do it locally, 10 minutes from your home. Let me switch gears and have Dr. Murray to come up here. So Dr. Murray is going to talk about 2 things. The concierge program that she runs with Leslie Crossley, and then also the movement disorder programs. Dr. Murray, maybe you can talk about the movement disorders first.
Right. Thank you all so much for having us. It's an honor being here. So one of the things I like to kind of kick off is to really kind of let you all know exactly what they're talking about, kind of with the culture. So one of the best things about being a neurologist and the RNI is that I get to do the thing that I love the most, and that's actually connect with human beings. And I think at the end of the day, one of the things I teach my students and residents, and one of the things that as world renowned as Dr. Rezai is, he has never, ever, ever once lost sight of, is that the foundation of the physician-patient relationship is a human connection. And I think when we start with the conversation there, one of the great privileges I've had is really taking care of thousands of Parkinson's patients at this point. And I start every appointment the same. I want to know your story. Because when I know your story, I'm going to know how this disease has impacted that. And then I'm going to take all the knowledge I have from the years of training and research and practice and apply my knowledge to return your quality of life. And that is my goal. And so we've taken that exact model. That's exactly how we treat every single Parkinson's patient. I start with saying, I want to know your story. I want to know kind of way more important is your story than what any physician has told you so far. And that's not an insult to them. That's because I need to know what's happening in your life. And we take that same model, and thankfully, again, due to Dr. Rezai's vision of neurologic care and lots of amazing people like Leslie and Dr. Hout and our whole team, and we're taking that model outside of just Parkinson's and saying that should be the model for care, period. Right? That should be the standard of care, that you don't need to go in and have a person just look at a scan on a screen and kind of run through a couple highlights and then throw a medicine at you. That is not humanistic medicine. That is kind of this volume-based model. And so what we've really done is trying to take that script and really develop this concierge line where that every single patient that comes through our concierge line from all across the world, actually. So we've had folks from overseas, we've had folks from all 50 states, and before they ever arrive in little old Morgantown, we have reviewed their scans, we've reviewed their records, we've talked to them, we've heard their story. And so what we're able to do is customize their day or two with us, and so that they don't, they touch down in Morgantown and they get to meet all the people that are going to try to make their life better, to give them a better understanding of what's happening in their disease, letting their family and kind of caretakers know what's happening in their disease, and coming up with a plan to do better. And one of the things I tell all of my patients, and again, many of you, if you don't know kind of a lot about West Virginia, one of the hardships of West Virginia is that we lead almost all categories in a bad way of healthcare, right? We have really, really high incidence of heart disease and diabetes and rates of smoking and kind of degenerative diseases. And so what we want to do, though, is change that story. Much like I said, I care about my patient's story, but I care about changing the narrative around brain disease. And I think one of the easiest ways to do that, again, is to partner with patients, partner with people that are living it, and us work together to really change that outcome. And so that's exactly what we've done. That concierge line has kind of really grown, and thanks again to lots of investment and interest in it. The thing that is a common theme is that no matter where people are getting their healthcare, unfortunately, it is often very disconnected and confusing, and you're often kind of run through all kinds of different departments, and at the end of that, nobody's really telling you what's going on. And so we pride ourselves on that connectivity to each and every patient, that customization of care, and that's exactly what our concierge line is. And so we're happy to kind of talk more about it, but that's really integrating the exact model we've used in movement and applying it to brain disease, period. That it really needs to be a different approach, because at the end of the day, a lot of places that even have really, really advanced healthcare teams are failing on the human side of medicine. And so that is definitely something, again, thanks to Dr. Rezai's leadership, he prides himself on. I couldn't agree more, and that's exactly the culture that we've created at the RNI.
we'll have later on time for questions, and also we'd like to have President Gee make comments at the very end how he formed this institute. So he's the one who funded it initially. And one of the key things is that, as Dr. Murray was saying, we don't care about the bottom line costs. We want to take care of the patients, so we don't charge the patients when they come for the concierge service. We have nurses moving with them from one place to the other, and that's the investment we make for each and every patient and their families to make sure that we're navigating these diseases together with them and providing the best care. And if we don't have the answers, many times we don't for neurological conditions, at least we can answer the questions to the best of our ability, so you're empowered by knowing what's in store, what can be done. So continuing on, this is our concierge program. So I want to talk the next 10, 15 minutes, and then we'll do questions regarding some of the research innovations, what Gene Young and others have supported. And a lot of the work that I'm showing has been supported by generous donors and foundations who want to make an impact. And we have a big model, what's called rapid cycle innovation. So when we moved to West Virginia, we brought teams. We're very impatient. We want to be safe, but we want to quickly do clinical trials. And we may not have a cure or a better diagnosis of treatments. If we fail, then we go back quickly and retool. So it is a big effort that's going on for translational neuroscience. Translation means you take animal research and basic science research that people do for decades, 20, 30 years, and you quickly deploy that towards patients. With the Food and Drug Administration, and you do initial proof of concept studies in a small number. If the results are safe and it shows that you're changing the way a treatment is done, then we can scale it and bring in many other teams and centers across the country very quickly to scale it and generalize the treatment. So in the past few years, we have 12 first-in-human FDA trials for Parkinson's, gene therapy for addictions, for Alzheimer's and other conditions. We'll talk about that. And it's all facilitated by a strong partnership between academia, academic medical centers, industry. We need pharma support, pharmaceutical, medtech, Medtronic, and other companies. They support us, foundations, and government partnership. It's not one team alone. You have to have multiple teams together to tackle big public health challenges and come up with substantive treatments that can help people and then scale it quickly. So that's the infrastructure we call rapid cycle innovation. The results of the team have been first in the world studies that have been done for addiction and Parkinson's with brain implants, focused ultrasound. We'll talk about that more. A smart pill that we developed at MIT that allows you to swallow a pill, and it remotely monitors your respiration and your heart rate and other vital signs for a week, and that sends a signal with telemetry. We're able to use technology to detect cravings and anxiety 2-3 days from now, and you don't have it right now. It's a digital, personalized predictive health, and magnetic stimulation, virtual reality, gene therapy, and brain-computer interface. You saw some of those in the clip that I showed earlier. So the team's results, we put our money where our mouth is. We publish in the top-tier journals by our peers who have to review what we do, and FDA, NIH, and we present our results in front of our peers because we have to have scientific validation. Without that, there's no results. So everything we talk about is scientifically published and validated. And the work of our team in the past 2 years has been featured in some of the large public media, 60 Minutes, Forbes, Good Morning America, and many others that talks about anything from domestic violence, work that's done to reduce domestic violence, to gene therapy for Parkinson's, new treatments that Dr. Murray's working on with a watch that you use for treatments of Parkinson's and tremor. 2 different companies, we can talk about that. So we want to use simple technology, not do complex brain surgery. So I need to be out of a job. You don't want to cut the skin and put a hole in the skull and do brain surgery. You want to become less and less invasive. That's the future. So let's talk about a few things. So let's talk about focused ultrasound. I've been doing since the first brain implants we did 26 years ago at New York University for people with Parkinson's. It's a surgery. We still do it. We're very active at it. So you do a surgery where you make an incision in the scalp, make a small hole the size of a nickel, and you deliver a pacemaker that is used for treatments of Parkinson's and tremors and epilepsy and obsessive compulsive disorder. Very effective. But what if we don't need to do surgery and can do this non-invasively in an outpatient setting with a 1-hour outpatient procedure. So now that's focused ultrasound. So you all know about sound. Let me give you just some background about sound. So the humans can hear anything from 20 hertz to 20,000 hertz. The human ear can hear that. If you have elephants or dogs and others, they have a wider range where you can hear sound. But ultrasound is anything with a higher frequency beyond what the humans can hear. 20,000 hertz and above to 300 megahertz. And that's important because that can penetrate the tissues and you can get diagnostics and therapeutics. And this is really the ability to focus the ultrasound has changed the world of neurotherapeutics. And this, we think, is a disruptive technology being applied across the country and worldwide. So ultrasound, you can have a probe looking at a baby in a womb. That's one ultrasound probe. We call it a transducer. Or you can look at the heart with echocardiography, looking at heart function. You can look at the vessels, Dopplers, and others. It is universally used in healthcare. But what about therapeutic ultrasound? You can use it for making a small hole in the brain to stop the tremor. The first application for uterine fibroids in the uterus with ultrasound, and prostate cancer, and many other areas. So the ultrasound energy can be harnessed to deliver a pinpoint area and affect function. So energy is very important. You have light energy, electrical energy, magnetic energy, and ultrasound energy to change the function of human tissue. So an innovation that's occurred is the ability to focus the beam into the brain, because the beam has to go from your head, through your scalp, through your skull, non-invasive without surgery, and go down 8 centimeters deep into your brain to a small area causing the tremor or causing the addictions and change the function, or to the area involved in memory and cognition for Alzheimer's. So the key innovation has been biomedical engineering, working with us on AI to be able to converge the beams into a pinpoint area, 1,000 beams converging in 1 millimeter area. And like a submarine sends a sonar, we also listen back so we know what the results of the beams are. So this is many times military technology is translated often to medicine. So innovations by DoD quickly gets translated to helping patients. So we've gone from diagnostic. All of you have had ultrasounds, I'm sure. Very common. Anybody who's had a baby, families, ultrasound, routine. Now we're going to brain therapeutics, and we think this is disruptive technology. So let's talk about the first application. We started it 12 years ago when Gordon Gee said, I'm going to support, he was at Ohio State, the president, said, Gordon, we need $2 million to buy this ultrasound system. He says, okay, you can have it. So that's where the investment comes in. So we started 12 years ago participating in the trial, but basically 1,000 ultrasound probes. You lie in an MRI. If a helmet comes over your head, this helmet has 1,000 ultrasound transducers. You need one to look at a baby in the womb. There's 1,000 of them. And we're delivering the energy through the skull without cutting the skin. And it's being delivered deep inside the brain to the area causing the Parkinson's and tremor. And it's a 1 to 2 hour outpatient procedure. This week we did a patient in their 80s from Georgia, and another one. So people in the 80s, 90s, people in their 70s and 80s are pediatric patients for us, because our most common age patients are 70s, 80s, and 90s. So anybody in the 60s is like an infant for us. So this is, and this technology is important because we're not doing surgeries. So let me show you an example of a patient with Dr. Murray. This patient had severe tremor for a decade and could not even take a cup of coffee without spilling it, and was shy to go outside with friends and family because he was embarrassed from shaking. So here's an example of the ultrasound procedure. This is before the procedure. We can get the audio up, please. Thank you. This is immediately after the procedure, gets off the table, tremor's gone. That's Dr. Murray examining the patient. He's able to write his name for the first time in a decade. It's a routine procedure. We do it every day, people in the 80s and 90s for tremor, for Parkinson's tremor. So that's an innovation. Take ultrasound that's used to look at a baby, harness the energy, focus it deep in the brain to a millimeter spot, and shut down the area causing the tremor without having to do surgery. That's the innovation. That's standard routine now. It's even being done here in Dallas and other places, so it's being done across the country. And so that's innovation. But let's talk about Alzheimer's. So I'm going to shift gears, talk about the research. This is not FDA approved. The ultrasound is FDA approved for tremor, Medicare reimbursed. We do it routinely every week and across the country is being done. We've been doing it for 12 years. So let me talk about the research work. So Alzheimer's disease, Dr. Hout can comment on this, but we're very excited about the potential for Alzheimer's disease and neurodegenerative disorders because we can use blood tests and imaging to detect it earlier. So the problem with Alzheimer's and Parkinson's, and Dr. Hout and Mary would tell you, for 20 years, your brain is degenerating and you're not aware of it until 20 years it reaches a tipping point, at which time you have the symptoms, the shaking in the hand, or a persistent pattern of forgetfulness, and that is a problem. You need to detect it a decade before. Imagine if you have a loved one who's got Alzheimer's, you knew 20 years or 10 years before the first external manifestation, what would you do? A lot can be done. So the key thing is to go back earlier and detect the disease with imaging and biomarkers earlier and earlier. That is the future. Detected before it becomes clinically, externally visible to you and your loved one. And then the other area, which is very exciting, is called the first time disease-modifying treatment. For the first time, it's not a cure, but antibodies that are routinely used for cancer or other treatments now are used to clear the plaques in the brain that are associated with Alzheimer's, called beta amyloid plaques. And the technology is showing twice a month infusions or once a month infusion for 2 years plus can clear out those plaques in the brain and reduce the progression of Alzheimer's by 30%. Not a cure, but 30% reduction in progression is good because you need a running start in a race against Alzheimer's. You have to be ahead of it. It's coming after you. You got to run in front of it and keep on clearing the plaques. So these disease-modifying antibodies are really important. You can see here, this is a PET scan in the brain. Placebo is a control. And lecanemab, it is an antibody. Lilly makes it. Biogen makes it. Eisai. And we are the third top prescribers in the world for this, several thousand patients and infusions. You can see here, this is all plaques here. And you can see with lecanemab, it significantly was reduced. So beta amyloid, it's not the result of Alzheimer's. There's a lot of discussion about it, but if you can clear the amyloid plaques, these protein clumps in your brain, you can reduce the progression of Alzheimer's. Not a cure, but it's a good start, and that has changed the game. And people from all over the world, it's the first patient in the country that had the Alzheimer's infusion right here. And you can see 3 different companies, the top journals in the world, FDA approved, Medicare reimbursed. You can get Alzheimer's if you meet the criteria, antibody every 2 weeks or once a month to clear the plaques so you can stay ahead of the plaques building in the brain, and that can help reduce the progression of the disease. It doesn't reverse it, but prevents progression of it. That's why the earlier you get it, the better it is. In fact, when we talk to our colleagues at Eli Lilly, those that have pre-Alzheimer's, preclinical, if we get to them quickly and clean out the plaques, they have a much better chance for the future. And then going on here, so problem is that antibodies, we have to give a lot of antibodies. Imagine every 2 weeks you get an IV, and we hang a bag of antibodies circulating, and it had to go all over your body from brain to your toes. It's going everywhere. And then it has to cross the blood-brain barrier to get into the brain. Do you all know what the blood-brain barrier is? It's a big problem in neuroscience. It's a natural barrier in all of our brains, protecting our brain, but the problem is that it prevents medications from getting into the brain. Chemotherapy for brain tumors, antibodies, other drugs don't readily get in. 98% of the medications that we take has difficulty getting into the brain. So imagine now if we can open the blood-brain barrier safely, allow more dose of the medication, 10 times the amount of chemotherapy to get to the brain, to the problem area with the brain tumors. So Blood-brain barrier is a challenge for delivery. So these are the blood vessels in your brain, and they have these tight junctions, these gates that prevent drugs to come in because brain is very sensitive, does not respond well to all kinds of drugs like other organs. So there's a protective barrier built in, but the flip side is that it prevents medications and drugs to get in. So more than 98% of drugs do not cut across the blood-brain barrier. And that's why you have to give high doses, multiple doses, months and years of doses, and they can have side effects. No medication without side effects. You have side effects of being confused or being more sleepy or other problems, GI, other side effects. So we want to see if we can break this blood-brain barrier, and that's what research has done. So people that are amazing, like Gene Young and others, have supported the research that allows us to open the blood-brain barrier on demand and deliver the medication. So let's talk about this. Here's a video from AP here. Can you hear this? So that's a graphic that shows how it works. So this has been a problem in neuroscience for 30 years. Ultrasound allows us to open the blood-brain barrier temporarily. So 3 applications of research. So why do you want to open the blood-brain barrier? Because these antibodies that I showed you, it takes 2 years to work because they have to get in slowly. They don't cross the barrier. But what if you can open the barrier, allow 7 to 8 to 10 times the amount of antibody to get in? So you don't need to give high doses, you give lesser doses, and you deliver it to the area of the brain where there's high plaques, or these beta amyloid plaques. So it's targeted to the area with the highest concentration. So again, that video shows, but basically our approach we've studied to show if we can deliver an ultrasound here, and this is antibodies being infused everywhere. But if we can open the blood-brain barrier, we want to know if we can deliver more ultrasound. So we can see here. So that was our goal, and we showed that you can reduce, this is the ultrasound treatment part of the brain. The whole brain is getting antibodies. The red means beta amyloid plaques, a PET scan. That's the plaques, the clumps in the brain. The area FUS means focused ultrasound, that the area with the plaques, the area with the blood-brain barrier is open, you can see it's gone, plaques are gone. So we're able to show that within, it was published in England Journal of Medicine, so 53% more at 6 months. And we're showing that with some of our patients, it's early on research, we need to do more, but we can clear the plaques in the brain within 3 to 6 months versus 2 years. And that's the potential hope for this. So active research going on. You can see in this scan here, this is reduction in the plaques in the brain. 0, you start with a 0 and you see how much you go down. And just antibody alone gives you 8-point reduction in 26 weeks. Antibody plus ultrasound, 166 points. Essentially, plaques are gone. And that's what this technology does. Second application. Now, it's bidirectional. When you open the blood-brain barrier, you can have medications get into the area And keep in mind, only the area we delivered ultrasound, blood-brain barrier opens and not outside. So it's very focused. You can't open the entire blood-brain barrier. It's not safe, right? But here's a problem with many conditions like chronic traumatic encephalopathy or frontotemporal degeneration or MS and others. You have a lot of brain biomarkers that don't necessarily easily get across the blood-brain barrier into the bloodstream for us to do blood tests. What if now we can open the blood-brain barrier and you can do a simple blood test, and those biomarkers go from the brain into the blood and you get a blood test. And that's the opportunity. Within 20 minutes, you can lie on the table, we open the blood-brain barrier, and this is called the liquid biopsy. It's not an open biopsy, it's liquid biopsy. You open the blood-brain barrier in the area of the tumor or around the MS plaques, around an area of chronic traumatic encephalopathy or Parkinson's or Lewy body or frontotemporal degeneration. And the goal is to detect these biomarkers years earlier before they accumulate and detect small concentrations, because when you open the barrier, you can get it in the bloodstream like tau and others. So we think this technology is very important for the future of tissue typing things with non-invasive, non-surgical brain biopsies. Very important. Third area in the last few minutes is neuromodulation. So we're not opening the blood-brain barrier. Now we said, let's use a different frequency of ultrasound to change the brain function. So when you have people that have low cognitive function or poor memory, you want to boost the areas involved in the memory called the hippocampus or entorhinal cortex or temporal lobe. And contrary, if you have people that have severe post-traumatic stress disorder or drug addiction, areas in the brain become hypersensitized and are super sensitive. They're on fire. So we want to deliver a higher dose to shut those areas down and improve post-traumatic stress disorder or addiction. So that was hypothesis, and you can see this is called neuromodulation. Instead of a brain implant, we're delivering ultrasound energy to modulate the areas involved for mood, cognition, anxiety, and addiction, boost the cognition and memory. This is research ongoing, on demand, or be able to shut down the areas that are causing the obsessions and the cravings for drugs or alcohol or gambling or others, because this part of the brain called the reward center of the brain is driving you to keep on seeking the drug. So there's a very focal part of the brain called the nucleus accumbens. Same part of the brain if you're a gambling addict, alcohol addict, drug addict, food addict, same area is electrically and chemically malfunctioning, is hyperactive, driving you with cravings to seek drugs, seek alcohol, seek gambling. And gambling is a big problem. Studies are shown men below 30, the biggest epidemic coming is FanDuel and this sports gambling that's going to take over. A lot of problems we're seeing people, life savings are being destroyed with just a simple flick on your phone, becomes a gambling tool. But this is impacting your brain. So neuromodulation results that we've done early on with Dr. Houghton and the team, we can deliver the energy to activate the parts of the brain involved in attention and concentration and memory. This needs more research early on with the hope of improving memory and boosting plasticity in the brain to allow your brain to function. So you know what brain plasticity is? This is how the brain can adapt. It is extremely dynamic and adaptive when you're a child, teenager. It's like a sponge, adapts to your environment. But the brain continuously evolves and is plastic throughout your life. In your 90s, 100s, brain is dynamic, always evolving. So you want to facilitate the plasticity of the brain so you can live life to the fullest with the best brain optimization function. Very important. Let me talk about the last couple of minutes. I keep on saying couple of minutes, but it really is a couple of minutes. The Admiral is going to give me the hook soon. Get out. Sorry. Okay, got it. Gene, can I go on? Yes? Okay. All right, so addiction. This is a big problem in this country. So we have 48 million people in this country that have a diagnosis of a substance use disorder. Alcohol, heroin, cocaine, benzos, fentanyl. It is ravaged the country in different ways. Methamphetamine. Overdoses are coming down good this year. So this year is 50,000 last year. But there's been 800,000 non-fatal overdoses. But one overdose is too much. One person who dies from overdoses too much. This year is 50,000. 2 years ago, it was 100,000 Americans who perished due to overdoses. And then there's a behavioral addictions, internet, social media, gambling, sports, eating disorders, food addictions, the food noise. You've heard of GLPs. Drugs impact food noise. The same part of the brain is involved in food noise and food addiction. And the problem is that when you get treatments for opioids, you've heard of methadone, Suboxone, Sublocade. This is for people who have opioid addiction. But there's no drug for methamphetamine addiction. There's no drug for cocaine addiction, benzo addiction. So we don't have drugs, and there are 14,000 addiction treatment centers in this country, 14,000. And several thousand people that go addiction centers that you pay. Medicaid pays $30,000 for you to go 28 days into an addiction center called the residential program. And the insurances pay $60,000, $70,000. People mortgage their house for their kids and family. You can pay $100,000 to go to a 28-day program. Less than 50% benefits from that. So they come out, and yes, during that time they're okay, but addiction is a brain disorder, so we need a brain treatment for addiction. Very important. Addiction is a big problem. So here's what we have done with ultrasound for addiction, and this is the work of the team. The audio is not playing, but basically it's food and other addiction. It's okay. I think the audio is something wrong with my computer. So basically, we deliver ultrasound into the area in the brain that is driving your cravings. There's a craving center. So what we do is we show pictures of whatever you're addicted to is personalized. Drugs, alcohol. If you're an alcoholic, you walk into a bar and you hear the ice hitting the glass or others drinking, you want to drink. If you're a gambling addict, see your friends doing on FanDuel or doing gambling, you want to do it. So the brain is very sensitive. And you're not born an addict, you become an addict over time, unless, God forbid, you're born to a mother who's an addict. But the brain keeps on changing, and addiction, it's rooted a lot in teenage years, children, when they're exposed to trauma, social trauma, other trauma, food insecurity, job insecurity, family trauma, sexual trauma, that changes the brain, and their brain becomes super sensitive to addictions, very much linked together. So the problem is that there's a part of the brain, is a biological problem underpinning the addiction. So what we've shown is that the same part of the brain that we can place an implant to treat OCD, we deliver ultrasound high energy to reset that part of the brain for addiction. So we show pictures of your personalized picture of what you're addicted to. Once you're super craving that picture, when you see drugs, alcohol, whatever it is, then we deliver a shot. Imagine if you have a heart arrhythmia. We want to bring the arrhythmia out and then stop the arrhythmia. So that's the concept. And the results are very promising, and this now is being done in Israel next week by our colleagues there. It's being done in South Korea and 7 sites in the United States. So we've shown that a 20-minute treatment of ultrasound delivered to the addiction center of the brain can reduce immediately 90% cravings for drugs or alcohol. Immediately, for people that have had decades of severe drug use and alcohol and have multiple overdoses, and 70% clean urine toxicology. How do you determine you're free of drugs? You do a random urine tox. That's your gold standard. 70% of them at the last visit, 6 months to a year, they're drug-free, despite before they've been taking 20 years of drugs. So we think this therapy needs to be scaled rapidly. We have an NIH grant working on this, and we're doing placebo randomized controls. And I believe if the results are sustained with more research, we are going to be able to, with other colleagues, show that we can dramatically change the world of addiction of all kinds. And that is using ultrasound technology. Here's the results that we published. Again, we publish everything. We don't talk if we don't publish. This is craving for people that have 20 years of severe heroin addiction, opioids, fentanyl, meth, cocaine, benzos, cannabis, alcohol. Patients in the study, baseline. Immediately after treatment, day 1, after a 20-minute treatment, the cravings went down dramatically, and we were shocked to find out, it's 4 years of work now, that the cravings remained low, so that part of the brain was reset, and there was gene expression changes. So what we're doing is opening the window of plasticity. It's not a cure, but now therapists can work with people who have addiction, and they can get to them and change their core functioning. So it's like teaching a child how to walk, teaching somebody with stroke how to relearn to use their arms. So that's what we're doing. So combining a 20-minute treatment plus therapy, we think can dramatically change the world of addiction, but it needs more research. Here's a couple of our patients from our study with the FDA and NIH. This lady had gambling and alcohol addiction. And this is just a couple more videos. So it's the cravings that are dramatically reduced. So then we said, okay, let's try this with the FDA. How about food noise? We see drugs, all drugs, alcohol reduced. So we say, why don't we see what happens with food noise? You know the concept of food noise? You wake up, you're thinking, these people binge eating and food problems. And that's what the GLP works on. The GLP-1 drugs work on food noise. That's why people are losing weight. So we said, why don't we treat with ultrasound, because the part of the brain involved in drug and alcohol addiction is also involved in food addiction for salty foods, sugary foods, and everything else. It's not just you craving ice cream, but it's people that are obsessed by taking ice cream and they're obese and cause a problem. So we did the same thing in 4 patients, and we saw the exact same results. A 20-minute treatment reduced food cravings by 95% immediately and sustained 6 months. And those that have binge eating is the most common eating disorder. Binge eating followed by bulimia and anorexia, the third. These are the 3 most common eating disorders. And 99% reduction in binge eating episodes. That's an objective scale. And then reduction in anxiety, depression. So the same results are being replicated, and that's why we're going after gambling as well next. You can see it's a patient who's lost 60 pounds. She was 400 pounds. And you can see day 1 with a 20-minute treatment, her cravings was reduced for fatty, salty snacks, and anxiety and depression reduced because the brain area driving the craving and anxiety is reset. Now the therapist can work with them to teach them how to make better decisions about food, eat healthier foods versus being driven by salty, fatty, and other foods. So our team here, due to the support of donors and others, has been able to make an impact using a new technology called ultrasound for people with alcohol use. We're doing gambling, binge eating, post-traumatic stress disorder, and with Dr. Murray working on hallucinations from Parkinson's and others, we think we can help hallucinations and tinnitus. These are all FDA trials that we're doing with research. So we appreciate the opportunity to be here. We have a unique team at this institute who are passionate, and they come from all across the world to make an impact for people having neurological and mental health conditions. The team is very purpose and passion built, and collaboration is very important. We collaborate with everybody, and we give our technology to everybody. You can't just hold it. You have to give it. That's why we're giving our addiction research technology to our colleagues in Israel, our colleagues in South America, in Korea. Koreans in Korea, methamphetamine is a big problem. People that have had 20 years plus of meth use, they're now not using anymore after ultrasound, and we're starting it in the US. It's a rapid cycle innovation, and it's about teams that are coming together with a purpose and passion to make an impact. There's Dr. Murray, one of our patients, that's showing thumbs up after the procedure. And brain health and wellness matters. It's not only about detecting a condition earlier, but also and treating it, but also promoting lifelong brain health and peak performance. So thank you. I want to bring President Guy up here to talk about how we formed this institute, and then we can take questions with the rest of the group here. So thank you. I appreciate the opportunity.
Well, everyone, how are you all doing? It's wonderful to be here with all of you. What a presentation. So I think, I'm not sure if you caught this, but at our Neuroscience Institute, we have done 12 first in the world processes, including opening the blood-brain barrier, etc. So it's been done in this little small state called West Virginia. And we lead the world in this kind of effort. So I became a university president at age 36. I couldn't even spell university when I became the president of one, and then in when I was 71, I decided to retire. So I'd been president of West Virginia, where I started, and then the University of Colorado, then Ohio State, then Brown University, then Vanderbilt University, and then I went back to Ohio State for a second term, and so I decided to retire from Ohio State, and I accepted a teaching position at Harvard University where I was teaching. And the folks in West Virginia called me up and said, would you come back? And I actually said, I'm so damn bored, I will be there immediately. And I only came back for 3 months, but then after I was there for a short period of time, I realized that this is a unique opportunity because very small state, we were a state that had raced to the bottom in everything. We had done everything we possibly could to not take good care of ourselves. And the only other state to race with us was Louisiana. And my daughter's the Secretary of Health for Louisiana, so she's done a terrible job. And so what I decided was that once I was asked to stay, I decided to stay. But what I determined was the fact that I was going to prove that one can reform a university. And you can do it in a very speedy and focused way, because as you know, our universities in many ways are under great stress right now, and we are bureaucratic. We're arrogant. We've done all the kinds of things that one should never do, and that's one of the reasons we have problems. We've lost the trust of the American people. So in this small state, I decided with a great university that we could build that we were going to do things in a much different way. And so we focused on 3 or 4 areas, one of them being education, obviously, one of them being healthcare, one of them being prosperity, creating jobs. I think that the university should create jobs. And then the other is making certain that every person who graduated from our institution had a purpose in life. You know, everyone gets a higher education when you graduate from a university. Very few people leave with a higher purpose. And I just think that's so incredibly important. So what I discovered, though, is that when I traveled the state, there are 55 counties in this state. And so what I would do is visited every county in the state. You can imagine in a small state, in a rural state, a bow-tied wearing lawyer, Ivy League lawyer showing up. I mean, they thought I was from Mars. And but I'd keep showing up. But what I discovered was that we had all these health deserts. People were just not getting access to great health care. And I made a determination that if we were going to change our university and our state, we were going to build a great health system. And that's what we started. And we decided we'd focus on 4 areas: neuroscience, right here. We would focus on heart. We would focus on kids, and we'd focus on cancer. I can say today, when I came, we had 3 hospitals. We now have 26. We service everyone in that state with world-class health care, not just simply good health care. We give better health care in West Virginia than you get in Texas. And I will just say that again. Yes, you know, I mean, you've got good institutions here, but everyone in our state can get access to great health care, and we do it in the right way. But one of the things I wanted to also show is that in a small state that had all these problems, that we could lead the world in doing things. I always point out, why in hell's sake would someone want to go to Rochester, Minnesota, awful town, just happens to have the Mayo Clinic there. But if you could come to beautiful West Virginia and to Morgantown, which is a beautiful city, and get great health care, and that is our goal. And so we wanted to lead the world in certain areas. And I can say right now that in the neuroscience area, no one in this country or anywhere around the world has a better track record than we do. And we're very proud of that. We don't want to hide it. We don't want to hold it as a precious commodity, but we want to make certain that we take it to the world and to prove that a small state, a small rural state, one that had raced to the bottom, could prove that you can change the arc of healthcare in this country by doing things in a much different way, and that's what we've done. So I'm very proud of that, and I'm very proud of this team right here, and we're very proud to be here. And Gene, thank you very much for inviting us, and Admiral, thank you very much for letting us be here. It's an opportunity to tell our story, but more importantly, it's an opportunity to be here. I am retiring in 2 weeks. I'm moving in. Yeah, if you'll let me move in, I'll move in. I love this place. I've fallen in love. So thank you very much. So Ollie, yeah, let's take some questions, okay?
Thank you, President Gee. And President Gee has been a tremendous supporter. So a lot of infrastructure was given to us, and we didn't ask for it because people in medicine these days say do 15, 20 minutes, but we don't do that. So